Let's discuss face reading, hyperplasia of the breast. Hyperplasia refers to an overgrowth of epithelium and fibrous tissue in the breast, the structural degeneration of breast tissue ducts and lobules, and the overgrowth of progressive connective tissue. Hyperplasia of the breast is a common condition in women. Hyperplasia is characterized by recurrent pain in the breast, which is aggravated before menstruation each month and is relieved or disappears after menstruation. In severe cases, the pain persists before and after menstruation. Hyperplasia is a result of endocrine dysfunction. Psychological factors such as bad mood and irritability are also pathogenic factors. Face reading, TCM, teaches that hyperplasia of the breast is mainly caused by stagnation of liver qi and emotional factors. The tongue will exhibit a pale texture with a white coating or reddish texture with dry coating. At the same time, the corresponding reflex zone on the face will show nodules or white spots. In women, there are fleshy bumps in the inner canthus. White spots are shown on their thoracic vertebral zone, the ears, and they will speak with their heads and mouths tilted to one side. All of the above suggested breast hyperplasia. So here is the illustration: nodules or white spots in the ear and fleshy bumps on the inner canthus. Therapeutic methods. In addition to treatment with drugs, therapies of hyperplasia should start with diet, lifestyle, exercise, and mood. Frequent rubbing of the breast can drench the ducts to relieve breast pain. Dietary advice: the overall diet should be low in fat and rich in vitamins. Maintain a balanced diet to prevent obesity. Exercise: continue to engage in physical exercise, but focus mainly on aerobic exercise. Do not engage in strenuous activity. Chest expansion exercises can help relieve pain. Emotional adjustment: learn to control your mood, resolve negative emotions promptly, and avoid being sulky or indulging in long-term depression, worry, and sadness so as to prevent aggravating the pain. Medicinal diet therapy: rose flower and kelp soup. Rose flowers 15 grams, kelp 100 grams, dried orange peel 5 grams. Wash the kelp and shred it. Wash the dried orange peels and tear them into strips. Put the rose flowers, kelp, and orange peel in an earthenware pot and cook for 40 minutes over low heat. This decoction is suitable for patients with hyperplasia caused by liver depression and phlegm stagnation. Rose flowers are effective for promoting blood circulation and removing stasis. Moxibustion applied to the Rojin, Hongfu, and Dangshu points to soothe the chest and regulate qi to relieve breast pain, and to the Susan Li, Feng Long, and San Jinjiao points to promote blood circulation and relieve pain. Apply mild warm moxibustion at the acupoints for above for 15 minutes each, once daily. Thank you for your attention.
Let's continue our subject on interviewing emotions and mental state. Mood swings are often seen when there is liver qi stagnation. There is no stability to the emotions because the liver is not ensuring that the qi is flowing smoothly. Heat in the liver will manifest with irritability, and the person can have a tendency to be temperamental and have a quick temper or be impatient. They will have a quick temper because anger is the emotion that resonates with the liver. Severe stagnations of liver qi can lead to a depressive condition. This is because liver qi stagnation can prevent the movement of the hun. This will result in a person having difficulty seeing a future ahead of them. They cannot conceive of a future or a situation that is better than the emotional pain that they are feeling at the moment. When there is liver qi stagnation, you can sometimes sense that there are pent-up emotions when the client describes their life. Phlegm can also lead to depression. Here, the shen becomes blocked and smothered. The person will have difficulty connecting to other people. The person can also seem torpid and difficult to engage. Heart chi stagnation and blood stagnation can also result in a person's shen having difficulty emanating outwards and connecting to other people. At the same time, the stagnation of chi in the heart can manifest with a lack of joy. Heart stagnation conditions can also lead to depression or depressive conditions. When the heart is harmonious, it manifests joy. If there is heart chi stagnation, there will be a lack of joy and the person will be gloomy and sad. Conversely, if the client says that they have lack of joy or love in their childhood and in adult life, this can lead to heart chi deficiency. The lung is affected by grief and melancholy. This can also be an aspect of a depressive condition. The person may mention a specific event that their condition can relate to, but it can also be something that is very far back in the past. Grief and loss do not, of course, have to manifest as depression. If a client talks of grief or loss, it may be something that has affected their lung qi. The metal phase gives us the ability to experience but also let go of grief and loss so that we can move on. If the metal phase is not in balance, its chi will not flow and the person will have difficulty letting go of grief. I usually ask patients whether they are good at saying no and setting boundaries. Liver deficiency conditions and liver chi stagnations can manifest to some extent in a person having difficulty saying no and setting boundaries. Conversely, by not being able to set boundaries, they will often develop a stagnation of liver chi. Mental restlessness and its extreme form, mania, is a sign of heat agitating the shen. So the person has difficulty concentrating and being tranquil. Anxiety can be related to certain situations or objects. It may also be undefined. Anxiety will weaken kidney and heart chi, but in itself, it's often a manifestation of heart and kidney imbalances. The memory depends on Jing, Shen, blood, Qi, and Yi. A poor memory can therefore be a reflection of imbalances in the kidneys, heart, and or spleen. Usually, it will be a deficiency condition, but phlegm and blood stagnation can also block the Shen and thereby the memory. Shock can also dissipate the Shen and lead to amnesia. Difficulty concentrating is seen when the heart and the brain are undernourished, blocked, or agitated. This means that the heart qi deficiency, heart blood deficiency, and kidney jing deficiency can manifest in poor concentration. The person will often feel empty-headed and a bit dazed. Heat in the body will always ascend due to its yang nature. Heat will agitate Shen, causing the person to have difficulty concentrating due to the mental restlessness and many thoughts filling the head. Spleen Qi deficiency can also cause a person to have difficulty concentrating because the weakening of their Yi will result in them having difficulty focusing their thoughts. Dampness and phlegm can also mean that there's difficulty concentrating because the person feels that their brain is wrapped in cotton wool. The blockage resulting from phlegm dampness means that information and impressions have difficulty penetrating into the heart. If I suspect that a client has phlegm dampness, I ask them if they have a foggy or blurred sensation in the head, as if there's a blanket smothering their mind or the sensation of being locked in a bell jar. This is the sensation most of us recognize from when we have had a heavy cold or have been hung over. So here we see the mental emotion signs. If a person has depression, it may be liver qi stagnation, heart imbalances, or phlegm. If the observation is speculation, he's worrying, thinking in circles, then it may be a spleen qi deficiency and dampness. If there's anxiety in the person, it may be a heart and kidney imbalance. If the person has wrath or anger, quick-tempered and impatient, it may be heat in the liver. If they have difficulty saying no and setting boundaries, then this is a liver stagnation or liver deficiency pattern and liver qi stagnation. If there is mental restlessness, then it may be due to heat. If the person has mood swings, it will be liver qi stagnation. If the person has poor memory, then there is heart blood deficiency, kidney jing deficiency, spleen qi deficiency, or phlegm dampness. If the person has difficulty concentrating, then this would mean heart blood deficiency, kidney jing deficiency, phlegm dampness, spleen qi deficiency, could be heart fire, phlegm fire, heat. If the person has a foggy and slurred sensation in the head, then this would mean phlegm dampness. Thank you for your attention.
Let's now discuss the acupuncture point Chou Liao, the elbow bone of the Hanyang large intestine meridian. Li12 or Zhu Chao is located at the lateral aspect of the elbow superior to the lateral epicondyle of the humerus. Li4 is named for its location in the depression of the outer elbow of the bone, mostly used for problems affecting the elbow, and it is the local point used for tennis elbow. This point disinhibits the joints, invigorates the large intestine channel. It is indicated for tennis elbow, swelling and pain affecting the elbow and arm. It is also for difficulty raising the elbow. This is a secondary point, but it is worth mentioning here because it's very useful to treat tendinitis of the elbow or tennis elbow, provided the main problem is along the large intestine channel. This for wind taxation with somnolence, contraction, numbness, and immobility of the upper arm, pain and stiffness of the elbow. This point is used in combination with other points. For swelling and redness of the arm with elbow pain, we use Li12 in combination with Li15 and Sanjiao or Si4 according to the Greaton Compendium. For pain and inability to raise the arm, we use Li12 in combination with Li14 according to Preserving Life. Thank you for your attention.
Let's discuss heart patterns, heart-yang collapse. Sudden loss of heart-yang is a critical condition due to extreme exhaustion of heart-yang and sudden loss of yang qi. Clinical manifestation apart from the symptoms of heart-yang deficiency, some other symptoms will appear such as sudden profuse, cold sweating, cold limbs, weak breath, pale complexion, or sharp heart pain, cyanotic lips, indistinct pulse, or even unconsciousness and coma. Analysis, this pattern is the further development of heart-yang deficiency. It may be caused by severe impairment of heart-yang, by pathogenic cold or obstruction of the heart by phlegm. Key symptoms is manifestation of heart-yang deficiency and declination of yang qi. So here is the analysis of symptoms of sudden collapse of the heart-yang pattern. Qi dysfunction of the wei qi, there is profuse cold sweating, cold sweats, decline of yang qi to warm the limbs, there is cold limbs. Deficiency of heart-yang, leakage of thoracic qi to help the lung perform respiration, weak heartbeats. Sudden loss of yang qi, weakness in warming the body, inhibited circulation of blood and vacuity of the vessels. So there is pale complexion. Inhibited circulation of blood and stagnation of blood in the heart vessels. There is sharp heart pain and cyanotic lips. Lack of necessary warmth and nourishment of the heart and dispersion of the spirit. Weak pulse or rapid weak pulse. An extremely weak pulse is a sign of declining yang qi, unconsciousness or coma. Differentiation between the sudden collapse of heart-yang pattern and collapse of yang pattern. For the pattern, sudden collapse of heart-yang and the collapse of yang, the common, there is both are critical conditions due to sudden depletion of yang qi, of which clinical manifestations are basically the same. For the cause and pathogenesis, sudden collapse of heart-yang, there is a disease. Disease is located in the heart and occurs on the basis of heart-yang deficiency. Key points for differentiation: symptoms of obstruction of the heart vessels, including palpitation, chest oppression, and pain, as well as dull, purplish complexion, lips, and nails can usually be seen. For the pattern of collapse of yang, the cause and pathogenesis, depletion of yang qi due to various factors. The key points for differentiation: some symptoms of primary yang deficiency appear before onset. Relevant advice: this is usually an acute pattern, therefore lifestyle and dietary advice is not so relevant. It is important that patient does not sweat because this will further weaken heart-yang. The three patterns, which are deficiency of heart-qi and heart-yang and sudden collapse of heart-yang, relate to three progressively worsening phases of heart function, from lack of function to further loss of function to acute and serious loss of function. The heart-qi deficiency pattern is characterized by such symptoms as palpitation and chest suppression and is accompanied by qi deficiency pattern. The heart-yang qi deficiency pattern forms on the basis of yang deficiency and is therefore characterized by a deficiency cold pattern, which includes chest pain, aversion to cold, and cold limbs. So here is the differentiation between heart-qi deficiency pattern and heart-yang deficiency pattern and sudden collapse of heart-yang pattern. For the syndrome deficiency of heart-qi, the cause is usual weakness of the body, lack of effective treatment and care for protracted disease, weakness in old age. Pathogenesis, no power to push the blood due to heart-qi deficiency. Common symptoms for the three syndromes is palpitation and fearful throbbing, oppression in the chest, shortness of breath aggravated by exertion, spontaneous sweating. For the different symptoms, deficiency of heart-qi has accompanying qi deficiency symptoms is pale or pallid complexion, pale tongue, white coating, weak pulse. For the syndrome of deficiency of heart-yang, the cause is further development of deficiency of heart-qi. For pathogenesis, weakness to propel an internal production of deficiency cold due to deficiency of heart-yang. Different symptoms, there is accompanying deficiency cold symptoms, aversion to cold and cold body, central chest pain, pallid or gloomy complexion, pale and enlarged tongue, white and slippery coating, thready pulse. For the syndrome sudden collapse of heart-yang, the cause is further development of heart-yang deficiency. It may be caused by severe impairment of heart-yang, by pathogenic cold or obstruction of the heart by phlegm. Pathogenesis, sudden collapse of heart-yang due to extreme exhaustion of heart-yang. For the different symptoms, there is accompanying deficiency of heart-qi symptoms, sudden profuse cold sweating, cold limbs due to reverse flow of qi, weak breath, pale complexion, cyanotic lips, unconsciousness or coma, red or dark tongue, indistinct pulse. Thank you for your attention.
We continue with pulse taking. Now let's talk about sunken or submerged pulse. This is even deeper than the deep pulse. To palpate it, it requires more force than pressing. to the point of reaching the underlying tendon or bone. Even then, the pulse is thread-like and feeble. Sometimes no pulsation is palpable. Clinical significance. The sunken pulse is a danger sign. It indicates that the pathogenic evil is so strong that it barricades the interior. It is also seen in syncope or extreme pain, cardiac shock, lung inflammation with shock, toxic dysentery, or massive bleeding. When evil chi is barricaded in the interior meridian, chi cannot move freely but is suppressed. Hence, the location of the pulse becomes very deep. Severely deficient genuine chi is too weak to activate pulsation. Hence, it also leads to a sunken pulse. A pulse which cannot be felt unless strong pressure is exerted to the level of the tendons and bones is called a sinking pulse. It feels like a ball of cotton wool on sand, soft on the surface, but strong and rigid below. It can only be felt when searched for and is comparable to a stone in water. It is deep and depressed like water, which sinks by nature. A sinking pulse, which is soft, slippery, and constant, indicates health. Yang qi is felt at the tsun position and is more important in male than in female physiology. Hence, in males, the tsun is the strongest of the pulses. On the other hand, yin qi is felt at the shi position and is more important in female physiology. Hence, in females, the shi is the strongest of the pulses. Therefore, provided the beats remain constant throughout the 4 seasons, it is normal for males to have sinking shi pulses and females to have sinking tsun pulses. A sinking pulse which is so deep it can only be felt by applying pressure to reach the bone is called a hidden pulse. A sinking pulse which is thin and soft is called a weak pulse. A sinking pulse which is wiry, big, and strong is called a firm pulse. The sinking pulse usually appears in a disease where yin channel water qi is abundant, sometimes even to the extent of water retention. The sinking pulse which is rapid indicates internal perverse heat. The sinking pulse which is slow indicates internal perverse cold. The sinking pulse which is slippery indicates internal phlegm. The pulse which is sinking but lacking strength indicates yang deficiency or sagging of qi. The pulse which is sinking and strong indicates stagnation or accumulation of cold. The sinking pulse can be felt at any of the 3 positions, Sun, Quan, or Shi, with each position associated with a specific disease. A sinking pulse felt at the Sun position usually indicates water retention or phlegm obstructed between the chest and diaphragm. The sinking pulse felt at the Quan position usually indicates accumulation and stagnation of pain-inducing cold in the middle heater. The sinking pulse felt at the Shi position usually indicates damaged Huan Yang in the lower heater, which causes vaginal discharge, incontinence of urine, diarrhea or dysentery, or kidney deficiency, lumbago. Thank you for your attention. Diagnosis according to Zhangfu organ patterns, liver fire. Liver fire and ascending liver yang are very similar in their etiology and pathology. The difference between them is that in liver fire, there are signs of heat, and liver qi stagnation or dietary reasons are more likely to be the root cause of the imbalance. Prolonged emotional imbalances can lead to stagnation of liver qi. In time, the stagnant liver qi will generate fire in the liver. Unfortunately, many people use alcohol as a way to loosen their stagnated liver qi. The alcohol will quickly dissipate stagnant liver qi, but it will also generate heat in the liver. Strong spices, such as chili, have a similar effect. Consuming foods that have a hot energy can either directly generate heat in the liver or indirectly create heat in the liver by creating fire in the stomach or blood heat that then transmits to the liver and creates heat there. Symptoms and signs: thirst, bitter taste in the mouth, red face, red eyes, red ears, sensation of heat in the head, aversion to or discomfort from heat, constipation. Dark urine, bleeding, quick body movements, hemilateral headache, that is throbbing in nature, throbbing pain or distension behind the eyes, dizziness and vertigo, tinnitus and deafness, irritability, aggressiveness, a quick temper and anger, impatience. Insomnia, the voice can have a shouting quality or have a hard tone. The eyes may be fixed and staring, red tongue with even redder sides and a yellowish dry coating, wiry and rapid pulse. Key symptoms are headache, irritability, red sides of the tongue, bitter taste, and wiry and rapid pulse. Treatment principle, drain liver fire and calm the liver. Acupuncture points, we choose from liver 2, GB20, 43, do 14, bladder 18, and pericardium 7. Needle technique is draining. Liver 2 and GB43 drain liver fire. 214 drains fire and heat. Pericardium 7 drains Jue and heat. GB20 drains yang qi from the head. Bladder 18 calms the liver. The patient should avoid consuming substances that create heat in the liver. In particular, alcohol, hot spices, fried food, and too much red meat should be avoided. Stress and pent-up emotions, especially anger and frustration, create heat in the liver. When there is liver fire, it is advisable to try to resolve these emotions. Physical activities such as sport, running, swimming, or dancing will be beneficial because it will disperse stagnant liver qi, which is often involved in the creation of liver fire. Liver fire can be caused by the following patterns of imbalance: liver yin deficiency, kidney yin deficiency, liver qi stagnation, stomach fire, blood heat. Liver fire can result in liver yin deficiency, liver wind, phlegm, heart fire, stomach fire, lung heat, blood heat. To summarize, liver fire blazing, etiology, long-standing anger, resentment, frustration, excessive alcohol, sweet fatty foods, red meat. Underlying or accompanying pathology includes liver qi stagnation transforming into liver fire, depressed internal damp heat. Signs and symptoms: outburst of anger, irritability, sudden onset tinnitus and or deafness, red face or eyes, bitter taste, temporal headache, thirst, dream-disturbed sleep, dizziness, constipation with dry stools, dark yellow urine, nosebleeds, coughing blood, vomiting blood, scorching hypochondrial pain. Pulse is wiry, rapid. Tongue, red, redder sides, dry yellow coating. Treatment principle, clear liver, drain fire, cool blood. Acupuncture treatment. Liver 2 clears liver fire. Gallbladder 34 forces liver qi. Liver 1 clears heat from the blood. The extra point Taiyang clears liver fire. Li11 subdues ascending liver qi. GB8 benefits the head, alleviates pain. Du24 eliminates wind, calms the shen. Liver 3 courses the liver. GB43 clears liver heat. GB20 subdues ascending liver qi. GB13 subdues ascending liver qi. GB1 benefits the eyes, clears heat. GB6 clears heat, alleviates pain. And spleen 6 harmonizes liver, calms the shen. Needle with drainage. Thank you for your attention. Tongue color inspection. We discuss crimson, purple, and blue tongues. Crimson tongue is a deeper red than red. The causes of crimson color in the tongue are the same as those for red color, except that heat or fire is stronger. Thus, crimson indicates extreme heat. In illnesses caused by exogenous disease, evil, a crimson tongue indicates that heat has entered the nutritive and blood levels, or heat is hiding in the heart and the stomach and transmitting in retrograde fashion into the pericardium. In internal illnesses, it indicates blazing fire in yin deficiency or depletion of stomach and kidney fluids. The tongue coating is correspondingly dry or fissured. A crimson and moist tongue with little coating suggests blood stasis causing internal blockage. Both red and crimson color indicate heat. The deeper the red, the stronger the heat evil. A change from light red to deep red to crimson indicates that the heat evil is strengthening and the illness worsening. Conversely, a change from crimson to deep red to light red indicates that the heat evil is retreating. A purple tongue suggests stagnation of qi and stasis of blood, or impeded blood circulation. The latter is due to exogenous cold or heat, deficiency of yang qi, alcoholic poisoning, food retention, phlegm, and room or dampness heat. If heat is strong and damages fluids, thus inducing qi stagnation and blood stasis, then the tongue turns crimson or purple, dry and dehydrated. If cold becomes gelled internally and induces blood stasis, then the tongue turns light purple or blue-purple but remains well hydrated. A blue tongue is seen in strong yin cold in the interior bottling up yang. As a result, the motive force for blood circulation is weakened, leading to blood stasis. If the entire tongue is blue, then yang is trapped in the interior by gelled cold. Yang deficiency permits gelling of cold, or there is blood stasis in the interior. If only the sides of the tongue are blue, then there is blood stasis. So we have here a tabulation of the tongues. Crimson tongue, abnormality, deep red. Crimson with dry or split coating signifies exogenous heat invading nutritive and blood levels, or heat accumulation in heart and stomach, direct transmission of disease evil to pericardium, or strong fire in yin deficiency, or exhaustion of stomach and kidney fluid in internal injury. Crimson with scant moist coating tongue means blood stasis in the interior. Purple tongue becoming dry and withered is qi stagnation and blood stasis. Heat consumes the fluids, qi stagnation and blood stasis due to cold. Light purple or blue purple and moist is blood stasis due to cold. Bluish tongue, the entire tongue is blue, cold bottling up the yang or yang deficiency permitting cold accumulation. Only sides of the tongue are blue, blood stasis in the interior. Thank you for your attention. Let's talk about epigastric pain, this time caused by stomach and spleen, deficient and cold. Clinical manifestations, dull epigastric pain, which improves with pressure after eating and with the application of heat, and vomiting of thin fluids, tiredness, poor appetite, chilliness, loose stools, pale complexion, tongue pale with white coating, pulse deep and weak. Some of the aforementioned manifestations reflect spleen qi deficiency, like tiredness, poor appetite, and loose stools, while others indicate stomach qi deficiency, the dull epigastric pain. In this case, yang qi is also deficient, resulting in feeling cold and cold leans. Treatment principle: warm the middle, strengthen the spleen and stomach. Points: Ren 12, stomach 36, bladder 20, 21, pericardium 6, Ren 6. All are needled with reinforcing method. Moxa applicable. Ren 12, stomach 36, bladder 20 and 21, tonify spleen and stomach. Moxa should be applied on the needle on stomach 36. The moxa box applied on the epigastrium is particularly effective to warm the middle and stop epigastric pain. Pericardium 6 stops nausea and pain. Ren 6 with moxa warms the yang and should be used if there are loose stools. The patient should avoid eating too much of cold energy food such as salads and fruit, although a small amount of such food eaten in conjunction with cooked food is acceptable. He or she should also make sure to eat enough in terms of quantity and not adhere too rigidly to various diets or food prohibitions on account of intolerances. Case history: we have a 47-year-old woman who had been suffering from epigastric pain for a few months. The pain was dull and improved with pressure and application of a hot water bottle. Her appetite was poor and she felt easily tired. She easily felt cold. Her tongue was very pale, slightly swollen, and with deep transversal cracks on one side. Pulse was weak and deep. This is a clear condition of spleen and stomach deficiency with internal cold. The transversal cracks on the side of the tongue indicate very long-standing spleen deficiency. The principle adopted was to strengthen the stomach and spleen and warm the center. This is the tongue of the patient. Spleen and stomach deficiency with internal colon. Thank you for your attention.